Cookery SOS is an online support program for mainly carers, but anybody that, shall we say, struggles with what I call the mindset of a hamster's wheel. We can all be racing around for the period of a day, getting stressed, and more stress is added to that, and get home in the evening. If we're not careful, we're not eating correctly. My wife was diagnosed 12 years ago with a progressive MS, medically retired after 2 years, and I couldn't cook a meal. She taught me to cook. I started up the Ice Cold Chef. It was a little bit of a pastime really, 10 years ago on Twitter. Professional chefs picked that up, and then they used to mentor me and help me to cook and design my meals and plate up in restaurant quality standard. To this day now, my meals are all done at home. Every day I go home after work and I cook a meal. I update them, hashtag them, and I hashtag carers in, and I now receive hundreds of messages a week across my social media asking for the tips and the mindset. I think when you get diagnosed, I suppose I'll talk from our experience, when you get diagnosed with something that's life-changing and there's no cure, there is no cure at the moment for this stage of MS. So that condition's going to constantly progress. You go through a period of time, I think, where you're grieving. You realise that the life that you had, it won't be there anymore. It's totally going to change. Your circle of friends change as well, because some of them can't cope with that, and they're replaced with other people that become stronger. The consultant and all the medical authorities give you the news. You sat there again. You don't really want that, but you go home and you think, what do we do? How do we move forward with this? How do we get back up? And when I started to update the meals and I started to hashtag carers, it soon became apparent that other people out there were going through the same processes. But some of them were taking a little bit longer to go through a process. It's a different time frame for everybody, but they all felt a little bit isolated, a little bit lonely. Where can we go? And there's only so much information you're going to get from Mr. Google. Mr. Google's great. It's a great thing to have. But after a bit, there is no answer. So you have to form the answer, and we managed to shape the answer with fresh food. That gives us motivation. It gives us the fuel, especially for me, because there's only me caring for my wife at home and working full time. It gives us motivation, the nutritional value, and it just keeps you going. And then all of a sudden, you wake up every morning, you realise when it hits you, it's like a juggernaut. It's not a nightmare, it's not a dream, this is real life, and you've got to go through another day. And the Cookery SOS is just a way of supporting everybody. Yeah, I actually think it's a massive online community programme, and how long has it been doing it now? Say about 10 years I've been with Cookery SOS as we devised that. And in the last 6 months now, the local doctor's surgery in Blackpool, they picked me up, the NHS, and we're looking at doing some work together there, collaboration work, where we're going to help other patients amongst that surgery who are struggling, shall we say, sometimes to cook a simple meal. They're relying on a ping meal, which, as we all know, is no good to anyone again. Well, I'll be running Cookery SOS programme there. So they'll come in, a patient will come in, probably struggling to cook. I think, well, I can't cook, John, I can't cook. Right, okay, have we got a slow cooker? Yeah, I've got a slow cooker. Where is that slow cooker? 9 out of 10 people have got a slow cooker stuffed in the cupboard in the box. Let's get the slow cooker out and let's start off with basic meals. And over a period of 6 to 8 weeks, bring them along with us, so where we get a bit more advanced, where they're used to using a pan and a hob safely, and now they've got the confidence, and then we can get another influx of patients and roll that out again. We all know social media gets a bad press at times, but used correctly in the way that we're all using it here, everybody here is using social media in the correct way, they're reaching out, they're hashtagging the correct words. I think if you're sat at home at the moment now and you are struggling and you think there's no end to it, and that dark tunnel is just going on and on, reach out. Have a look for the Ice Cold Chef. Have a look for the World Health Innovation Summit. There's so many people of a depth of knowledge that want to share that with you and help you. You are not on your own anymore.